Good evening and welcome to another episode of the program, Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Authority, NHIA, and the stride it is making to achieve its mandates. In this episode, we will share highlights of more activities that shaped 2022 for the NHIA. In this episode, we shall review activities the NHIA embarked on, particularly after assent to the new NHIA Act in 2022 and the reaction of stakeholders and development partners to the development. The NHIA also strategically expanded its operations with the induction of 11 new HMOs and organized several stakeholders engagement and capacity building workshops for top management and staff of the authority, among other events. Why don't you join me after the break for the full package? My name is Aisha Muhammad Ahmed, your regular anchor. Please don't go away.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the National Health Insurance Authority. Details coming up shortly.
The Director General, NHIA, Professor Mohammed Nasir Sambo, has called for innovative financing for health insurance, as government alone cannot finance the provision of health insurance in Nigeria. He made this call when he addressed the 13th Annual Forum of Laureates of the Nigerian National Order of Merit in Abuja. Professor Sambo said implementing health insurance in a resource-constrained environment is difficult, but if Nigerians accept health insurance and contribute, it will result to a very large pool where resources can be drawn from. He explained that health insurance anywhere is not free but contributory. However, if the amount pooled is limited, the NHIA has to prioritize which ailment to treat. That means enrollees may have limited access to care.
The bigger the pool, the better.
He further called on Nigerians to embrace health insurance as it keeps a nation healthy and productive, suggesting innovative ways to finance it.
Implementing social insurance in a resource-constrained environment is not an easy task, because the amount of money that you will pool will not be sufficient to cover all the diseases. Therefore, you have to prioritize. It's not the fault of health insurance, because health insurance anywhere is not free, it's contributory. And if the contribution is low, it is that amount of money that you will use actuarial scientists, scientific permutation to know how much disease burden it will cover. This social insurance is for all of us. It is a system that has a very great effect on our citizens. Therefore, we need to support it, and we need to do every advocacy. In fact, what we are doing to implement this social insurance law now, I'm going to inaugurate a committee on innovative financing. When we were brainstorming on innovative financing, somebody said individuals are being given oil blocks. Is that not right? Why can't you give oil block to Nigerians and say that this oil block, the proceeds from it will go into financing healthcare for the people, for the vulnerable? This is innovative financing.
The Association of Nigerian Health Journalists has suggested that governments at all levels design unique universal health coverage models that can address the peculiar health needs of Nigerians. This call was met at the 6th Annual Conference of the Association, tagged Health Security, Universal Health Coverage, and NHIA. How can Nigeria get it right? The role of the media in perspective. The association also called on the federal government of Nigeria to put in place modalities that will enable the attainment of universal health coverage so that Nigerians can have access to quality and affordable health care. In a communique jointly signed by the President Hassan Zagi and the General Secretary Nigerian Adebola, stressed that no single universal health coverage model is suitable for all countries, as individual countries have peculiarities which could be approached specifically. Health journalists also expressed determination to increase sensitization on the importance of health insurance so that political leaders, well-to-do individuals, states, and local governments can enroll citizens. The group also commended the current leadership of NHIA in managing the work environment and driving the organizational goals of the agency.
The program is Easy Access to Healthcare for All, sponsored by the National Health Insurance Authority. In the year 2022, the NHIA made great strides in various areas of its operations. Like I mentioned at the beginning, it embarked on capacity building and training of staff towards understanding their new roles under a new act. It inducted new HMOs, engaged in stakeholder conferences, among other events. In this episode, we review some activities that shaped 2022 for the NHIA. Please stay tuned.
The year 2022 was characterized by transformations from being a scheme to an authority. The role of the NHIA was redefined, just as the nomenclature of the Executive Secretary changed to Director General, amongst other things. All these changes put the authority on a pedestal towards the fulfillment of its mandate to Nigerians. This singular move of passing the new NHIA Act launched the country onto the trajectory of achieving universal health coverage that strategically attracted development partners across the globe. These partners included World Health Organization Health Financing Mission, which came on a week-long visit to Nigeria.
Today I'm here because there has been a new development, the NHIA Authority Bill. And I'm here again because I believe that's the way to go. NHIA hold the promise to transform health access to healthcare in Nigeria. So this is really a good opportunity for us, and it's a privilege indeed, to be part of this high-level advocacy visit, to review where we are so far, how we will operationalize this new health insurance authority bill, and how WHO can further support to strengthen NHIA to deliver on a mandate.
Globally, it has been acknowledged that the best way to attain universal health coverage is to ensure that you provide financial risk protection to people.
Another of such visits was from Cheryl Cashin, R4D's Managing Director from the Washington, D.C. office, who is a master technical facilitator and expert in health financing. R4D has partnered with NHIA on several initiatives, including the development of the 10-year strategic plan, capacity building for management, as well as the NHIA Leadership Development Program. The essence of her visit was to acknowledge the authority's efforts so far and to also provide technical support for the authority as it works towards attaining universal health coverage.
In Nigeria, and for the NHIA in particular, really congratulations on the elevation of the status. It's such an important statement, I think, for the importance of the National Health Insurance Scheme, of this authority in advancing universal health coverage in Nigeria. We in the global community are looking on with great interest. We're feeling the energy right now at this moment, the energy and the commitment towards advancing UHC. And so to be able to be here and be part of that dialogue is truly an honor. As Dr. Hope mentioned, that at R4D, we really, of course, we know this is your way forward. It's your way forward to chart and to make happen. And what we can do, I hope, is to share a bit from some insights globally, some other observations and lessons that we've been able to synthesize and just to share for you to possibly take along as you elevate the agenda for UHC in Nigeria.
With this giant stride, and bearing in mind that the authority has decentralized its processes to states, the NHIA had constantly engaged its stakeholders in 2022 to further cement the health insurance under one roof initiative.
When this law was signed at the level of the TMC, we sat down and developed a strategy to first of all ensure that every stakeholder in Nigeria has appreciated the ABCD of this law. Because if we don't appreciate the law, it will be very, very difficult for us to implement it the way it should. So that's why we embark on a series of stakeholders engagement. And today's meeting represents one of the most important stakeholders engagement that we are going to do. For the fact that the 83 million vulnerable segment of the population that will be covered under the law, under this law, will be driven at the state level. It is going to be driven through the mechanism of implementation of basic health care provision fund. Therefore, the role of commissioners and the role of state health insurance agencies is very, very critical in implementation of this law.
Specialized capacity building to top management and staff was also top priority for the NHIA in the year 2022.
The essence of the training of the top management of the authority is to expose us to the rudiments of accounting processes, documentation, for the day-to-day financial decisions and supervision of the functions of finance and accounts and the internal audit departments. This is also to improve their coordination and supervisory roles of the two departments. Specifically, the objectives of this training, as enumerated by the committee in their report, are as follows. 1. Increase the efficiency and understandability of the functions of Finance and Accounts Department. 2. Ensure improved financial management decisions.
The assent to the new NHIA Act by President Muhammadu Buhari in 2022 necessitates that the authority expands its operations and stakeholders alike. In this light, the NHIA held induction for 11 new health maintenance organizations.
It is important that we avail ourselves with opportunities to understand the business processes, the rules and regulations governing the system. More especially in this respect of the healthcare maintenance organizations, whereby there is an enabling law and there are enabling guidelines which help the organization to manage the ecosystem without any hitch. So normally we organize this kind of induction workshop, we familiarize ourselves and we familiarize with those laws and statuses that will come to live with it.
Because its operations are evolving and there is need for modification in order to accelerate its service delivery, the NHIA in 2022 organized a 3-day stakeholders retreat on the eNHIA business process and design of dashboard for real-time analysis.
There is a need for all the departments that are involved in this program, especially the DICT and the programs department. By programs department, I mean the formal sector, ISD, that's informal sector, the contribution management, standard and quality department, and of course the planning department, because we are going to talk about data. So to come together and then look at this program holistically, how far we have gone, so that we can now dot the I's and cross the T's to prepare for the launch by the president during the Nigerian Health Insurance Summit. So that is why he brought us together to this place and engaged a consultant that has been part of the dream of NHIA, or 10-year strategic plan for him, to put us together to define our business processes. Again, so while we have a look at our business processes, the business processes of each of these departments and how they will plug in to the facilities already implemented in the eNHIA platform. That's exactly what we have come to do.
The authority is leaving no stone unturned to be able to give Nigerians easy access to health care, as well as achieve its mandate of universal health coverage.
The program is Easy Access to Healthcare for All, and it continues with our stakeholders segment. In this segment, we will sample opinions of different stakeholders on health insurance under one roof umbrella and how this initiative by the management of NHIA is helping towards the attainment of universal health coverage. We start with the Chief Executive of Anambra State Social Health Insurance Agency.
Looking at Sustainable Development Goals 3, Target 8, that is clearly stating achieve universal health coverage. So, in the context of that, you now realize that there is a destination, which is universal health coverage for Nigeria as a country, and then there are actors who should do that. And then the vehicle itself that should take us to that destination called universal health coverage was now coined by Professor Mohammed Nasir when he came in to say, let us galvanize all of the critical stakeholders that will take us in on this journey towards our destination of universal health coverage. Therefore, in a cascade that looks like a house, okay, at the roof, you have the National Health Insurance Scheme coordinating, and then the state social health insurance schemes at the not lintel, maybe you talk about the parapet area, and then you now have pillars that will represent the struts that are holding the building, different strategic partners, and towards the base of it, you now have those truly who are implementing the scheme, talking about healthcare providers, international donor organizations that are supporting, and then ultimately the enrollees who are the beneficiaries. Okay, looking at the supply side, the demand side of health insurance, and then the regulators, both at the states, which is subnational levels, and then the national level, to bring all of these stakeholders together to ensure that we are all in one vehicle, discussing issues, coming up with policy briefs, panel beating all of this to see how we can successfully navigate Nigeria from the point of disjointedness towards the destination, which is universal health coverage.
Although states operate on different laws, they all work in line with the NHIA operational guidelines.
Every state has its own law, but the laws are in line with guidance we received from the National Health Insurance Scheme. That is to say that the laws are not very different, and this explains why what we're doing will rhyme. They will be like what the other states are doing. And so the laws provide for an agency that will coordinate the execution of health insurance in the various states.
The NHIA is seen as a pillar of strong support for state social health insurance agencies as they collaborate with the authority in various areas.
almost every activity that we undertake in the contributory agency is being supported by the National Health Insurance Scheme. That ranges from sensitization, advocacy, and even courtesy calls to the targeted beneficiaries, especially under the informal sector program. We work hand in hand together because we have this health insurance under one roof, and part of the agreements signed during the retreat was that we have to work hand in hand, we have to share things together, we have to share our data together, we have to work together to ensure that we achieve the presidential mandate of universal health coverage.
The greatest collaborating vehicle now is the health insurance under one roof, and also knowing fully well that the Basic Care Provision Fund, which is the federal government effort to give health to the poor and vulnerable by making available 1% of the consolidated revenue to the states, so that they can engage and enroll poor and vulnerable. Now, this is one of the major linking points between the State Social Health Insurance Scheme and the National Health Insurance Scheme. And so this partnership has led to a lot of other avenues for us to collaborate and also structured our activities on the same plane, so that everybody in that landscape have a common point of meeting. So those are the areas where we meet.
The new NHIA Act makes health insurance mandatory for every citizen. Dr. Fabong Jem Chang speaks on its impact.
It's a welcome development for the people of Nigeria and for us in the health insurance ecosystem, because the law, as it were, was long overweighted and is long overdue. So with the assent of the president to the law, it makes it a lot easier for us to achieve universal health coverage in Nigeria now.
You have heard from key players in the health insurance sector speaking on partnership with the NHIA and the move towards the attainment of universal health coverage. Let us take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: what is the gift-ship program?
It is supposed to be all-encompassing program that will cover G, group of people, I, individual, and F, family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this program today. If you have an issue or complaint as an NHIA enrollee, visit your state office. The NHIA is structured to meet you at the point of your health needs. Join us again same time and on the same station for another interesting episode as we continue to bring you more stories of happenings around the NHIA. Enjoy the rest of your day.